Now, I've talked to you today about the Mediterranean diet, the specific carbohydrate diet, and the Crohn's disease exclusion diet. These diets all have some similarities and many differences. So, knowing how to implement these diets and understanding the content of these diets can be very challenging without appropriate resources and help. So to make things simple, we published on the first IBD food pyramid in a high impact journal called The Lancet Gastroenterology and Hepatology earlier this year. This food pyramid serves to prioritize specific foods and food behaviors in order to maintain overall health in an individual with IBD. And this food pyramid consists of 5 priority behaviors that have been either shown to reduce inflammation in humans or in animal models. So there are certain levels of data associated with each of these recommendations. And therefore, these food recommendations have been specifically chosen to inform the first IBD food pyramid to overall improve the course of disease. Now, the first 2 priority behaviors are rich intake of multicolored fruits and vegetables. Multicolored fruits and vegetables are not only rich in dietary fiber, particularly prebiotic fiber, but they're also rich in polyphenols, which are specific dietary compounds which have been shown to improve inflammation and improve the gut bacteria. The first rung of this food pyramid is also recommends rich intake of leafy greens between 1 to 2 servings per day. Leafy green intake has been associated with decreased intestinal inflammation in 2 food studies that we recently have completed. Priority 2 behaviors include rich intake of starchy foods, particularly foods that have starches that have been cooled or reheated. And again, starchy foods have been associated with an alteration of the gut bacteria in order to be friendly for the individual that has IBD. Priority 3 behaviors focus on choosing healthy meals, particularly homemade meals, and limiting processed foods, baked goods, and foods with food additives. As I've shown you, the large prospective study highlighted significant new disease together with higher intake of processed foods. And for that reason, particularly for reasons associated and seen in animal models about how processed foods may affect that mucus layer in the gut and reduce that important barrier, healthy meals, homemade meals without food additives are recommended. Priorities 4 and 5 surround choosing healthy proteins and choosing healthy fats. We recommend choosing white meat more often than red meat, focus on fatty fish, as well as nuts and seeds, together with that of healthy fats, with a recommendation for olive oil for reasons that previously have been discussed. So please review the IBD food pyramid to give you an idea about how to prioritize your food behaviors in a way that might be helpful to minimizing inflammation and improving your overall symptoms. So today we have reviewed the growing literature for diets and diet components and how they may be involved in IBD onset or affect the course of IBD. But choosing the right diet and implementing a diet plan that is right for you can be very challenging. There are lots of things to consider in this journey, including where do I start? What foods do I prioritize if I am in remission or experiencing a disease flare? How do I incorporate the ideal nutrients and food components into a meal? How do I remember the various foods and nutrients that are beneficial for my IBD? To help you with this, a novel mobile application called the Lifemd has been developed specifically for you. The Lifemd mobile application is an evidence-based diet and nutrition tool to help you become the healthiest, happiest individual that you possibly can be. When you use the Lifemd tool, you will be asked to complete validated food questionnaires. These food questionnaires will assess your current food intake patterns and your food preferences. Based on these 2 items, the Lifemd application will provide you with specific food goals, behaviors, and targets that are personalized for you. These goals and targets will take into consideration your dietary preferences, as well as the important factors that will help you take your dietary quality to the next level to help manage your gut inflammation. You will be able to track your dietary practices and your dietary behaviors over time to have a sense for how well you are performing with the diet. In addition, you will be able to track your symptoms and see how adhering to the dietary patterns recommended in the Lifemd app may correlate with improvement in your symptoms as well as your overall well-being.